peace, gratitude, and highest heart love. Welcome to the YouTube live book reading of Clinical Application of Respiratory Care. I'm your moderator and narrator, Uriel Riley. We are starting on the second chapter of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Chapter 2. Welcome, YouTube. Peace and the highest heart. Chapter 2. Cardiovascular Anatomy and Physiology. Although man's knowledge is embarrassingly meager in the biochemical and biophysical phenomena of cellular life, it has been known for over 2 centuries that oxygen must be continuously supplied to the cell and carbon dioxide continuously removed from the cellular environment in order for life processes to continue. This process of gas exchanging across permeable cellular membranes is defined as respiration. Although the field of respiratory care is commonly thought of in terms of the pulmonary system, one cannot deal with respiratory processes without a thorough appreciation and understanding of the cardiovascular system. Since the purpose of this text is to provide a firm foundation for the practitioners of respiratory care, it becomes essential to deal with the function and physiology of the cardiovascular system in some detail. We may consider a general approach to the cardiovascular system as being concerned with three component parts: the heart, core; 2, the blood vessels, conduits; and 3, the intravascular volume, content. If one has a basic knowledge of these three C's, core, conduits, content, the ability to deal with cardiovascular system in relation to respiratory care is greatly enhanced. The heart is an organ designed to impart energy to the blood in sufficient quantity to provide circulation throughout the vascular system. The heart should be considered as two pumps in a series. Two pumps are necessary since there are two capillary systems that must be dealt with: the systemic circulation and the pulmonary circulation. The systemic circulation services the vast majority of tissues and therefore requires a higher driving pressure. Thus, the left heart must produce enough energy to supply this far reaching vascular system. On the other hand, the right heart must produce only enough energy to circulate the blood through the smaller pulmonary circuit. This requires a lower driving pressure. Peace, YouTube. Highest heart love. Welcome, Sammy. Thank you guys for being here. We're on page 26 of this wonderful, masterful book, Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Master level readings. Bottom of page 26. The conduits are a series of vessels allowing rapid transit of blood away from the heart and back again. The arterial portion of the circulation is defined as those conduits that carry blood away from the heart and toward the capillary beds. The capillaries, the microcirculation, low exchange, allow exchange of gases, water, salts, nutrients, metabolites, and other substances across permeable membranes. In the systemic circulation, this exchange is between blood and tissues, and in the pulmonary circulation, it is between the blood and the atmosphere. The venous circulation is essentially a collecting system which allows for the return of blood to the heart. It is the low pressure portion of the conduit system and contains the bulk of the blood volume. Unlike arteries, the veins are capable of having great changes in volume with little change in pressure. They are referred to as the capa- capacitant vessels. The content of the vascular system is the blood, a liquid medium with a large assortment of particles ranging all the way from molecular to microscopic to just subvisual in size. The blood is involved in numerous complex functions and has numerous physical properties such as 1. Osmotic factors, 2. Ionic particles demanding a moment to moment state of electric neutrality, and 3. Various dissolved gases, 4. Hydrostatic pressure relationships, and 5. Permeability relationships, to mention a few. The heart. Peace, everyone. Highest Heart Love. Oh, thank you so much, Highest Heart Love. Thank you for being here and reading masterful books with us. Yes, you ever seen a $3,500 book? Well, here it is. Thank you so much for being here and reading with us. We are now at page 27 in the middle. The heart. The heart. Anatomy. The heart is a hollow, muscular organ enclosed in a membrane called the pericardium. Three layers comprise the heart muscle wall. One, an outer layer called the epicardium. Two, a middle layer called the myocardium. And three, an inner layer called the endocardium. This inner layer is lined by squamous endothelial cells, which are continuous with the endothelial lining of the major blood vessels attaching to the heart. The heart is composed of four separate chambers. Figure 2.1. We'll see in a minute. The two atria are thin, muscle wall structures which act as collecting chambers for the veins. In addition, the atria supplement the delivery of the blood to the ventricles by contracting at the appropriate time. The two ventricles have thick, muscular walls and are the basic pumping chambers of the heart. The right and left heart, each composed of an atrium and ventricle, are separated by walls of fibrous and muscular tissue. The separating walls are called the intraatrial and the intraventricular septum. Peace, peace. Blood supply. The nutrient supply of the heart is via the coronary arteries, which originate from the aorta at its junction with the left ventricle. Figure 2-1. Here's figure 2-1, so you can see clear. Page 28. A. C is at the top with A and B. Here you go. The heart. Thank you for being here and reading Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. This is the second edition. Thank you so much. This is beautiful. I love physiology and anatomy. It's always been one of my favorite subjects, you know, and masters are mastering. So what it says here, at figure 2-1, functional anatomy of the heart. A, 3 pulmonary veins from the left lung. 4, left atrium. 5, mitral valve. 6, left ventricle. 7, intraventricular septum. 8, endocardium. 9, myocardium. 10, epicardium. 11, right ventricle. 12, inferior vena cava. 13, tricuspid valve. 14, pulmonary semilunar valves. 15, right atrium. 16, pulmonary veins from right lung. 17, the right pulmonary artery. And 18, superior vena cava. C, anatomy of the specialized myocardial conducting system. 1, SA node. 2, specialized arterial conducting tracts. 3, AV node. 4, bundle of his. And 5, right bundle branch. 6, left bundle branch. And 7, the Purkinje's fibers. Thank you so much. I know this is super deep. Highest heart love. Thank you so much for reading this masterful book with us. The openings, the top of page 29. The openings to the coronary arteries lie within the cusp of the aortic valve and depend upon the pressure in the aorta, primarily during the diastolic period, for their perfusing pressure. This corresponds to the relaxed state or diastolic period of the heart, during which time most the heart perfusion occurs. Major venous drainage empties into the coronary sinus, which is located in the coronary, separating the ventricles from the atria. The coronary also contains the left and the right coronary arteries. See figure 2-1a. The coronary sinus empties into the right atrium. The minor venous drainage empties directly into the right and left ventricle and is known as the thespian veins. Nerve supply. The autonomic nervous system has a role in regulating the heart rate. Ding! The vagus nerve, part of the parasympathetic system, slows the heart rate. The cardiac accelerator nerves, part of the sympathetic system, increase the rate and strength of contraction of both the atria and the ventricles. Functional anatomy. The functional anatomy of the heart can be described in terms of the normal transit of blood through its chambers. See Figure 2.1b. Venous blood returns from the systemic circulation through two main channels, the superior and inferior vena cava. Both of these structures empty into the right atrium. The right atrium is separated from the right ventricle by the tricuspid valve. The right ventricle empties into the pulmonary artery through the pulmonary valve. From the pulmonary artery, the blood flows through the pulmonary circulation, eventually reaching the pulmonary veins. The left atrium contains the openings of the four pulmonary veins. The left atrium empties into the left ventricle through is through a bicuspid valve called the mitral valve. The outlet of the left ventricle is through the aortic valve into the aorta, the main artery of the body. The cusp of the aortic valve in the cusp of the aortic valve are important since this is where the right and left coronary arteries originate. During contraction, systole, the tricuspid and mitral valves are closed while the pulmonary and aortic valves open, allowing the ventricles to pump blood into the pulmonary artery and the aorta, respectively. During relaxation, diastole, the tricuspid and mitral valves are open while the pulmonary and aortic valves are closed, allowing blood to flow from the atria into the ventricle. During diastole and aortic pressure is responsible for supplying the majority of flow through the coronary arteries to the myocardial tissue. Page 30. Thank you for being here. Highest heart love. Oh my goodness. Thank you so much. Thank you. Highest heart love. I'm Master Uriel Neville Riley, Master Fitness Trainer, Master Poet, and Father, reading to you live from the light in LA. Histology. That's right. In addition to ordinary connective tissue cells, there are two major types of heart cells that must be distinguished. One, the myocardial contractile cells, which are the majority of the heart muscle cells. And two, the myocardial conduction cells, which have nerve-like properties. The basic myocardial contractile cell is a multinucleated cell whose length varies from 30 to 60 microns and width from 10 to 15 microns. There are abundant organelles, mitochondria, found throughout the cell, denoting its high degree of metabolic activity. Electrochemical change in the cell activates intracellular components, leading to the activation of contractile proteins. Such activation causes leading to the activation of contractile into such activation causes interdigitation of these muscle cell elements, leading to mechanical shortening. This is an example whereby electric stimulation results in mechanical activation. In addition to the myocardial contractile cells, there are special cells that can initiate and efficiently conduct electrical impulses. These myocardial conduction cells have characteristics closely resembling nervous tissue and are the cells which normally spread impulses rapidly to all areas of the heart. A major collection of these specialized cells is located in the right atrium and is referred to as the sinoatrial SA node. Yeah, the sinoatrial, which is the pacemaker of the heart. From the SA node, a group cells referred to as the specialized atrial conducting tracts conduct the impulse to the next configuration of specialized tissue called the atrioventricular, the AV node. This collection of cells is located at the base of the Yes, the intraatrial septum near the tricuspid valve. A function of the AV node is to facilitate a delay in transmission of the impulse from the atria to the ventricles, allowing the atrial muscle cells to contract and augment the volume of the blood delivered to the ventricles. From the AV node, the impulse travels along a specialized tract of tissue called the bundle of His, the initial conducting tract of the ventricular system. The tract then divides into structures that are called the right and left bundle branches, and which continue on to the respective ventricles, dividing and subdividing into a complex of fiber network, and eventually ending in what are called the Purkinje's fibers. Oh, thank you. It's hard though. Thank you so much. Oh my goodness, it's so good. Anatomy and physiology. Yeah, we're here. This is the Masters corner of YouTube where we read books and learn from masters. Thank you so much for the likes and subs. We're pushing towards 5 because of your support. Thank you so much. Masters Corner. The ventricular conduction system allows a rapid and uniform distribution of electrical impulses to the myocardial contractile cells. The conducting activation of the heart is normally from the inside to the outside. And we'll pause right here, continue back this masterful reading. We're at page 30 at the bottom of clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout, second edition. Thank you so much. And as you see, we're getting into what is on the cover, right? So we can help others around us, those this can really accent your knowing of the anatomy of your body, how to help one another, anyway, breathing techniques. We're in the second chapter of this masterful book. I'm your moderator and narrator, Uriel Riley. Thank you so much for being here. I want to give a shout out, special love and highest heart love to my elder cousin, one of my hundreds of cousins, thousands actually. Great Nico Blaze Nicholas Dwayne Ingram. Thank you so much for all you've done for us. Thank you to continue to bring the light, reality, a real gentleman, wonderful father. Thank you so much. Love to all my family and friends. Thank you to all my mods and loves. I love you. Sending love to everyone all around the world. Thank you so much. Oh, you are beautiful too. Thank you for that. Thank you. I will see you soon and we will pick back up. I love you, Bubbles. Thank you so much. I love you, Dad. We're coming in. I'll see you soon. Peace.